The time is 1:54 p.m. This is the beginning of Media 4. We are back on the record.
Mr. Henchman.
Thank you.
I'm going to get it probably about 4:30. I'm going to hand you a document that we're going to mark as Exhibit 13. This is excerpts from a book by Dr. Gaylor and Dr. Argoff entitled Defeat Chronic Pain Now. Do you recall ever seeing this book in your work with Mallinckrodt?
No.
Earlier, and if you need to refresh your recollection, you can look back at Exhibit 10. We saw a notation in some of your notes that you had disseminated some information from the CARES Alliance in your work as a sales rep for Mallinckrodt to a Dr. Booth, or both. Do you recall that CARES Alliance testimony?
Yes.
But you don't recall seeing this Defeat Chronic Now book that is affiliated with the CARES Alliance as part of that CARES Alliance information that you may have disseminated?
Yeah, I don't recall anything about the CARES Alliance.
Let me flip back over to, again, this isn't the whole book, it's just excerpts from the book, but flip over to the page 175, 176. There's a heading there that says, do opioids cause addiction in chronic pain patients? Do you see that heading?
Yes.
The book states, first, we need to define what addiction is and is not. So many people confuse addiction with another biological process, physical dependence. Did I read that correctly?
Yes.
We're sure you have read the newspapers and seen on TV the accounts of people claiming to have become addicted to OxyContin. Did I read that correctly?
Yes.
Absolutely. This is a major societal issue that needs to be dealt with. However, in our opinion, many of these folks on TV appeared not to be addicted, but rather had developed a physical dependency, which is a normal bodily reaction that happens with lots of different types of medications, including medications not used for pain, and is easily remedied. Did I read that correctly?
Yes.
Was that the types of information from the CARES Alliance that you were disseminating to doctors like Dr. Both?
Objection. I don't even recall anything about the CARES Alliance, so I would say I can't recall.
And I understand you don't recall anything about the CARES Alliance specifically, but what I'm asking is the message that I just read from this book, affiliated with the CARES Alliance, was that the type of information and messages that you were delivering to doctors like Dr. Both when you put in your notes that you were providing him information from the CARES Alliance?
No.
Objection.
So you don't think that those were the types of messages that were being sent in that information?
Correct.
But you don't recall specifically the information from the CARES Alliance that you delivered to Dr. Both?
Correct.
Flip over to the next page, 176. There's the paragraph beginning, by definition, addiction. Do you see that?
Yep. Yes.
Third sentence in that paragraph beginning, when chronic pain. Do you see that?
Yes.
I'm going to read it. When chronic pain patients take opioids to treat their pain, they rarely develop a true addiction and drug craving. Did I read that correctly?
Yes.
Was that your understanding when you worked at Mallinckrodt, that when chronic patients take opioids to treat their pain, they rarely developed true addiction?
I can't recall.
You don't recall if you had that belief while you worked at Mallinckrodt?
Correct.
You don't recall forming any belief whatsoever about the addictive qualities of the opioids that you were selling?
I can't recall at this time.
Do you, as you sit here today, do you agree with that statement?
I do not have opinion on it one way or the other.
Council, I don't see the copyright info on this. Could you just get that to us at some other date?
I will be happy to.
Thanks.
I'm going to hand you a document that we've marked as Exhibit 14. It's entitled the Field Conference Report for Eric Henchman on May 28th through 29th, 2013. Do you recall seeing this document when you worked at Mallinckrodt?
No.
Do you see that it appears to be written by Paul Jones based on the signature block on the following page?
Okay.
Do you see that?
I see his name on it.
Do you recall receiving field conference reports in your work with Mallinckrodt?
Yes.
What were the purpose of these reports?
I would imagine it was a summary of when he would work with us out in the field.
And we had already looked at one of his field reports for you earlier in Exhibit 12, I believe it was. I'm sorry, maybe 11. Exhibit 11. So this is just another sort of summary from where Mr. Jones does one of his ride-alongs where he goes out in the field with you?
Yeah, I mean, I would imagine just like every ride-along, every month, there might be something else that the company's going to want to look at. So, yeah, that's fine. This would be one of them, I assume.
So the field report begins, Eric, I wanted to thank you for 2 good days in the field. I'm glad to see your Exalgos start to move and know you can hit your goals this quarter. Did I read that correctly?
You said goals, but it's goal, but yes.
Well, what was your goal during the quarter, if you recall correctly?
I have no idea.
Your goals would typically be set based on the amount of Exalgo scripts written in your territory, correct?
Sure.
Your average needs to be 16 a week, and you are currently averaging 14 and a half for the first 7 weeks. Did I read that correctly?
Yes.
And then there's a graph showing your prescription rates, I assume?
Okay. Yes.
Do you see that?
I see it.
So when he says that your average needs to be 16 a week, is that the goal that you had set for that quarter?
It wouldn't be my goal. It would be the goal that the company would set for me.
I understand, but the company was setting sales goals for you in your promotional activity with regard to Exalgo, right?
Objectives.
And when it says 16 a week, what does that mean?
I would imagine that means 16 Exalgo scripts per week.
And you were a little bit below that, apparently, through the first 7 weeks, correct?
Looks that way. Yes.
And then Mr. Jones writes, as we discussed, you need more consistency from your writer. Did I read that correctly?
Where does it say that?
It's the next sentence after the one I previously read.
Yes, I see it.
What does he mean by, or what did you interpret it to mean when he tells you that you need more consistency from your writer?
I'm not the one who wrote it, so I don't know.
But as you sit here today, what do you understand that term to mean?
I don't know what you mean by more consistency from your writers.
He goes on to say, you currently and only one consistent writer and have approximately 10 others that write every other week or so. Did I read that correctly?
Yes.
Does that inform you about what he means by more consistency from your writers?
Could be.
The key is to know exactly why the right. Did I read that correctly?
Yes.
Do you assume that that's a typo and he means they write, right?
Yes.
Is it last resort or after and upon a failure? You need to know this so you can address it individually on every call. Did I read that correctly?
Yes.
When he says call, he's meaning your in-person visits, right?
Yes.
So what he's telling you to do is that you need to have a better understanding about why the physicians within your territory are writing Exalgo scripts, right?
Objection number 4.
What type of patients he would, yeah, that would be the best fit for Exalgo?
And then he continues, continue to use the Exalgo iPad app like you are, but tailor to each call based on their needs and ask for more consistent use. You have the relationships. Did I read that correctly?
Yes.
When he says you have the relationships, he means you have the relationships with the writers in your territory to begin to ask them for more consistent writing, right?
Objection affirmed.
Yes.
And that's because at this point, at this company, you've been with them for a year and a half and have developed pretty good relationships with the prescribers and the writers in your territory, right?
Possibly.
He says, the next time we work together, I know I will see progress in this area. Did I read that correctly?
Yes.
So it was expected from your superiors that you would follow through on the command to better understand your prescribers and get more consistent writing out of your prescribers in your territory, right?
Objection.
One could interpret it as that.
Did you interpret it that way?
I don't know how I interpreted it at the time.
How do you interpret it today as we sit here and you see this document again?
I'm not sure what he means by the consistency and, you know, so I don't.
Well, he says you only have one consistent writer, right?
Okay. Yes.
And then he describes what an inconsistent writer is, right? When he says, and have approximately 10 others that write every other week or so. Did I read that correctly?
Mm-hmm. Yes.
So it seemed like a consistent writer is somebody who's writing Exalgo scripts every week, right?
Objection affirmed.
Okay.
And then
Yes.
an inconsistent writer is one who's writing them every other week or so,
Okay.
Same objection.
right?
Yes.
So what he's telling you is that you need to leverage your relationships with the prescribers in your territory to get Exalgo scripts written every week.
Same objection.
I think he would be implying that because I have relationships, because I've called on the physicians, that I can continue to message the physician on dosing, product information, disease state awareness, etc.
Then it closes on the last page. Eric, I am happy. I'm sorry, let you get there. Last paragraph. Eric, I am happy with how you have progressed so far this year and see you making impact where you put the effort and attention as you have been with Johnson City Pain. Did I read that correctly?
Yes.
So we saw in earlier emails where at the beginning of the year in 2013, you were having those problems getting in to see Johnson City Pain physicians, and you were consistently trying to get there at the end of 2012 once a week, right?
Objection affirmed.
No, I don't. No, that's not right.
You don't recall the email correspondence where you told your superior that you were going to be at this Johnson City Pain every Wednesday for the rest of the year, and that was in November of 2012?
Yeah, but
Same
it wasn't because it was a problem. It was just because I hadn't been prioritizing them to see them
That's right.
on a weekly basis.
And so now you prioritize them, and according to this, you've successfully converted Johnson City Pain over to writing scripts for Exalgo, right?
Objection affirmed.
That would be, I guess, among other, I was able to increase relationships and help promote the medicine and the disease state with them.
And we saw earlier that they were reluctant to write those Exalgo scripts because they thought that it had significant abuse potential and had a high street value, right?
Same
That's what that
objection.
email said.
And so now where after that email, you're getting patted on the back by your superior for getting Johnson City Pain to write Exalgo scripts. So that suggests that you convinced them that Exalgo did not have abuse potential and its street value was not high?
Same objection.
Yeah, I don't know if I would say convince them. No, I wouldn't say I convinced them. I would say that the information that was provided to them maybe helped them make a better decision about what they should prescribe to some patients.
So they were prescribing Exalgo, notwithstanding they still carried the perception of its high street value and strong potential for abuse.
Objection to form.
I have no idea what their perception was.
Well, again, you're being commanded by your superiors here to know why your physicians are writing Exalgo scripts, right?
Objection.
But that would be, I don't know what's going on in the minds of physicians, so I can't, you know, they're not going to make a decision based off of just what I say. It's just not going to happen. I wouldn't expect that to happen.
Okay.
So they've been to medical school, they make their own decisions based off of what they know, and so I'm trying to bring some kind of educational value to them. And so part of the educational value would be talking about my product and, you know, and benefits of that product.
So after you learned that the physicians at Johnson City Pain were reluctant to prescribe Exalgo because of its abuse potential and its high street value, you didn't talk to those physicians again after they started writing Exalgo scripts to understand if they continued to have that perception even though they were now writing scripts for that drug?
Objection to form.
Yeah, I would write, I mean, I'm sure I probably continue to call them on a weekly basis. What I was talking to them about, I can't recall.
That wasn't my question. You scroll up. My question is, so after you learned that the physicians at Johnson City Pain were reluctant to prescribe Exalgo because of its abuse potential and its high street value, you did not talk to those physicians again after they started writing Exalgo scripts to understand if they continue to have that perception even though they were now writing scripts for that drug?
No,
Same
I
objection.
can't recall. Thank you.
Just handed you a document from April 2014. This is email correspondence between Todd Drew and you. Do you see that?
Yes,
The subject line is a weekly push report, right?
I believe so.
Do you recall receiving these weekly push reports?
I remember getting sales numbers on a weekly basis.
And would these, you can spend as much time with the email, it's several pages long, but feel free to look at it, but would these be those sales reports that you would get on a weekly basis?
Yeah, yep.
And so, again, because it's titled Weekly Report and you've testified that you got such weekly reports, and I don't want to go through all of them, but can we assume that this is roughly the information that you would get on a weekly basis while you're at Mallinckrodt?
Objection to form.
Sure.
There's something kind of confusing about this email I was hoping you might be able to clarify for me. It uses an acronym called WONK. W-U-N-K. Is that whereabouts unknown?
I would believe so.
So there was a database, according to this document, where there would be physicians who would be tagged with the description of a wonk. Is that your understanding of that database?
Where are you referring to?
Sure, it's no problem. On the April 23rd, 2014 email at 11:16 p.m., you write 3 bulleted items to Todd. One of them is, finally, I added Ryan Groth into my territory last month, and he is showing up as a wonk in the Exalgo exclusion list now.
Okay.
Do you see that?
Yes.
So apparently you, I assume this was done on a computer system, you went in somewhere and added Ryan Groth into your territory, and now he's showing up in some computer system as a wonk.
Sure. Yes.
So I guess I'm confused. Like, what is the computer system that's around, or that's kind of being described here?
That I can't recall.
Don't remember.
I would imagine on my call notes there would be a place where you could, or not call notes, but wherever we would enter our calls in, that there would be a place where we could add a physician.
And just to be clear, based on your prior testimony, when you use the term calls, you're really talking about your in-person visits, right?
Yes.
You're not talking about calls on the phone.
Correct.
There's also a reference to an Exalgo exclusion list. Do you see that?
Yep. Yes.
What is the Exalgo exclusion list?
I can't recall. Let me read the sentence first.
Sure, no problem. Take your time.
Yeah. I'm not sure.
If you needed to know the answer to that question, who would you have asked?
Well, it looks like I was asking my my district manager, who would have been Todd.
Anybody else you might have asked about if you needed clarification about what an Exalgo exclusion list is?
Not that I can recall.
So go further down on the first page here. There's a April 23rd, 2014, 9:01 p.m. email from Todd Druin. You see that?
Yes.
And it says, the push report is out, and I am sure that you have reviewed the file that was sent to you personally from corporate already. Did I read that correctly?
Yes.
There is good news and not so good news based on the information embedded in this report. Did I read that correctly?
Yes.
The good news is that we are doing very well with PenSed and Exalgo. The bad news is that it's only 23% of the IC plan. Did I read that correctly?
Yes.
So I want to unpack that a little bit. What is the IC plan?
Imagine it's the incentive compensation plan.
So this is the plan where you will receive a bonus based on the number of Exalgo scripts written in your territory?
Yep. And PenSed and Exalgo.
Were you separately compensated for those?
Objection to form.
What do you mean separately?
Well, and this is probably getting back to the nature of the IC plan, but if you hit your targets for Exalgo but missed your targets for PenSed, would you get a bonus for meeting your targets for Exalgo?
I can't recall.
Don't remember. Okay, this email goes on and says, I know that XXR will pick up soon as we continue throughout the quarter. Stay focused and do not get discouraged by the slow uptake of your physicians. Did I read that correctly?
Yes.
So in April of 2014, that is about the time when Mallinckrodt started the rollout of marketing Zardamus, right?
Objection to
Came
form.
on the market right around that time, right?
I'm not sure.
You don't remember?
Nope.
And the reference to XXR here is to Zardamus XR, right?
I would assume so, yes.
So, and then you see on the next page, there is a chart. Do you see that?
Yes.
And the first chart is the XXR chart. Do you see that?
Yes.
And under the XXR header there, it says, congratulations to Teresa and Eric this week for getting their first scripts. Did I read that correctly?
Yes.
So does that suggest to you that this week was the first week that you had a Xartemys script written by one of the physicians in your territory?
Yeah.
And so prior to that, you can see in the chart you have 0, and then the next week you have 3.3, right?
Yep.
Can you explain how you get 0.3 of a prescription?
I can't. No. I can't remember.
On the next page, there's a header with Exalgo. Do you see that?
Yes.
And it said, it was a good week for Exalgo as well. Everyone deserves a pat on the back for such a strong performance. The IC plan is only for the month of April, so keep that in mind that next Wednesday is the last day of April. Make a strong push without negating XXR or 2% because no one wants to leave 7% of the IC plan on the table. Did I read that correctly?
Yes.
What does he mean by nobody wants to leave 7% of the IC plan on the table?
I would imagine he means don't ignore whatever the 7% is. Just like anything else that would be like on the table. You want to ignore it.
So in other words, he's trying to make sure that you guys are hitting your Exalgo sales targets so that you can fulfill your incentive compensation plan so that you can get your bonus at the end of the quarter or at the end of the year.
Objection to form.
Yeah, and so he can get his bonus, and yeah.
So is your understanding that your sales manager, well, let me strike that. Was Todd Druin your supervisor at this time?
Yes. I guess so. I would assume so.
Sorry, I'm just trying to stay organized over here. The document that we've marked as Exhibit 16. Do you see that this is email correspondence between you and Todd Druin in November of 2013?
Yeah, sure.
It looks like, again, feel free to spend as much time as you want with this document, but it looks like this is kind of an introductory email for when Todd started taking over as your supervisor, right?
Yep.
And you're commenting on how you're both sort of GSK alumni.
Okay.
You see that?
Yep.
You say, I really wanted to switch from big pharma to small pharma, so this has been a great fit. Do you see that?
Yes.
Do you remember why you wanted to switch from big pharma to small pharma?
I can't recall.
And then, again, this is kind of an introductory email, and he had asked you a question about what your expectations of a manager are, and then there's a paragraph here that says, my expectations of my manager are simple. Do you see that?
Yes.
And then it says, quote, help me drive results in my territory, be a partner in my business, and help me solve any problems or answer any questions that I can't figure out by myself. Did I read that correctly?
Yes.
What were you meaning by drive results in my territory?
Help me be as successful as possible in my territory.
But driving results in your territory would have been getting scripts for Mallinckrodt products in your territory, right? That's the result you're talking about.
No, not necessarily.
But what other result are you looking to help your manager drive you towards if it's not more scripts in your territory?
It could be help me with any issues that may come up, any product knowledge that I may have questions about, any competitive product knowledge I may have. It could be a plethora of different things that he could be helping me with.
But none of the things you just listed is a result. I'm curious by what you meant. Drive results in my territory. What results are you talking about if it's not scripts for Mallinckrodt products?
I don't know right now.
Well, one result would be driving prescriptions for Mallinckrodt products, right?
Possibly be.
And then the email goes on with a paragraph. There's a personal paragraph about you. We'll skip that. And then it says, my goals. Do you see that?
Yes.
My goals for 2014 is to make a ton of bonus money launching Zardemis and finish in the top 20% in the nation. Did I read that correctly?
Yes.
So that would be one result that you're talking about that you want to help him drive in your territory, is to get tons of bonus money launching Zardemis, right?
Objection affirmed.
I didn't say in here that that's one of the results. So one of my goals would have been to make a lot of bonus money. But to equate him saying that I'm going to drive results in my territory that he's going to help me with doesn't necessarily mean that you can't necessarily put the two together.
Sure. And so how would you make a ton of bonus money launching Zardemis?
Exceed my goals and
Sorry.
expectations.
So in other words, have scripts written for Zardemis, right?
Objection affirmed.
If that was part of the incentive compensation plan, yes. Sometimes there's other things that are included in your incentive compensation plan besides just scripts.
Sure.
It
But
could be-
scripts is one thing included in that plan, right?
Yes.
And we saw in the last email your weekly sales report that you got, that you testified that you got on a weekly basis. The only parameter that that's measuring is scripts, right?
Objection affirmed.
That one document, yes.
Yeah. I want to switch gears a little bit here. We've been talking a decent amount about your in-person visits, and I know that you also said some of your promotional activities revolved around speaker programs.
Correct.
I want to talk about speaker programs a little bit.
Okay.
This is email correspondence between you and Paul Jones in March of 2013. So it looks like Paul is still your supervisor at this point, right?
Okay, yes.
And this email correspondence begins with Paul stating to you and what I appear are the other sales people on his team. Is that fair?
Yes.
It says, I am presenting my business plan to the home office leadership team, including Steve, our president. I need you to send me some data. Did I read that correctly?
Yes.
And then he talks about how many Exaglo speaker programs have you completed since October 1, question mark, right?
Yes.
How many Exaglo programs are scheduled for future, question mark. Did I read that right?
Yes.
How many Exaglo prescribers do you have since October 1, question mark. Did I read that correctly?
Yes.
And then presumably he's also asking for the same data on some of the other products that Mallinckrodt was promoting at that time, right?
Yes.
And then you respond, Exaglo speaker programs completed since October 1, 2. Do you see that?
Yes.
How many Exaglo programs are scheduled for the future? Johnson City dinner program next Tuesday, March 12th. Bo is paying. And I am planning to do a dinner in April, but not officially booked yet. Did I read that correctly?
Yes.
And then you provide a prescribers Exalgo 16, Pensed 22, Sumavell 4,
Duexis.
Duexis, thank you, you saved me, 2. Is that the number of prescribers that had attended the 2 speaker programs since October 1?
Objection to form.
At this point, I don't know. Okay, my business plan.
So this email is dated March 2013, right?
Yes.
And if there's been 2 completed since October, and that would cover approximately 5 months, is that right?
Yes.
Is that pretty consistent with how often the speaker programs were held?
I think it would depend on the territory, the availability of the speakers. I'd say generally speaking, sure.
Do you recall if the Johnson City speaking event went forward?
That I'm not sure of. No idea.
Did you schedule the Johnson City speaking event as a result of the previous email that we saw where the Johnson City folks were reluctant to write scripts for Exalgo because of abuse potential and high street value?
Objection to form.
No. We would be, I wouldn't, the territory included Asheville or Western North Carolina and part of Tennessee. I'd have a speaker program, say in the Tri-Cities area, one in Asheville, maybe one west of Asheville, wherever my territory would be. But it wouldn't be specific to that.
Got it. Describe to me kind of what a general speaker event would look like.
A dinner program?
Yeah.
It would either be at a restaurant, hotel. We'd have a speaker come in, meaning like a physician, more of a higher level physician, maybe somebody who the other doctors would know. And then they would talk about, I mean, they had a slide deck, and it was, I guess, an approved slide deck that would come from corporate. And it would talk about disease state, benefits of Exalgo, side effects of Exalgo, if there was a black box warning, specific requirements within that approved slide deck. So physician would show up, they'd listen to it, they'd have dinner. They'd have dinner, and then usually the speaker program.
And then in this email it references Bo as paying. Who's Bo?
He would have been another counterpart in our territory, or probably an adjoining district.
So these would be Malincrot paid for events, right?
Yes.
Malincrot would pay the speaker, right?
Yes.
And Malincrot would develop the slide deck for what would the speaker would be presented.
Objection
Yes.
to form.
Did the speakers convey the information we saw earlier in the CDER report about the addiction risk of Exalgo being on par with OxyContin?
I would have no idea at this point.
Well, you attended the speaker events,
I
right?
don't recall. Oh, yes, I recall that I attended the programs, but I don't recall the specific information that was in there.
Did the speakers convey that Exalgo is not FDA approved as an abuse deterrent opioid?
Objection
I'm
to
not
form.
sure.
Did the speakers convey that the CDR report concluded that the more scripts written for Exalgo, the greater increase of abuse, addiction, and diversion?
Objection to form.
I can't recall.
The speakers would convey the benefits of the product, though, right?
Yes.
Objection to form.
And the purpose of the speaker events was to get the physicians who attended to write more Exalgo scripts, right?
Objection
No,
to form.
not necessarily.
Well, then what was the point of paying for the dinner, taking the time in the evening, paying the speaker, developing the slide deck, if it wasn't to push more Exalgo scripts?
Educational purposes. the doctors weren't going to stand up there and push any specific product.
Well, they're pushing Exalgo, right? Because it's the only drug that they're talking about.
Pushing is not the right word. They would be educating, and then they would be talking about the benefits, but I want to associate benefits with pushing the medicine. The benefits and potential side effects, maybe proper patient types that it would work best for. But the doctors are not going to sit up there and push a product. They're just, from my experience, they're not going to do that.
Do the speaker programs include information on opioid addiction in general?
I'm not sure.
Did the speaker programs have information about opioid diversion?
I'm not sure.
Objection to form.
Did the speaker programs include information on opioid abuse?
Same objection.
I'm not sure. I can't remember the specific slides, any of them.
Did Mallinckrodt use saving cards in its promotional activity in Tennessee?
I believe so.
What is a saving card?
I would imagine that would be a card to help with the copay, the amount that the patient would have to pay, which is pretty much every drug I've ever promoted, which probably is 30 different medicines, I would imagine, all had some sort of a copay card.
And this is so that when the patient is going to fill their script, they can provide this card to the pharmacist and get a reduction in their copay, correct?
Correct.
And that's to help defray the cost to the patient themselves for purchasing the medication.
The
right?
out-of-pocket costs.
And as you said, they are pretty consistent across the pharmaceutical industry, right?
Yes.
And that's because they're effective, right?
Objection to form.
They help reduce the amount that's paying out of pocket. So I would assume if they weren't effective, I guess if they weren't effective, they wouldn't be using them.
Yeah. And the reason why they're effective is because it encourages people to fill scripts once the doctor orders them.
Same objection.
I think that most patients aren't going, if the doctor is going to suggest a certain medicine, they're going to get that, they're going to not object to that. Because the doctors, with all their years of education, medical school, they feel like their doctors are making the right decision for the patient.
Sure. But, I think that we can all agree that patients generally are going to follow the advice of their doctor.
Yes.
But to the extent that they wouldn't, one significant barrier to that might be the cost of the drug on the back end, right?
Objection to form.
Possibly, yes.
And then one way to defray that is with these savings cards, right?
Same objection.
Yes.
You can say safely.
Savings cards.
Oh.
Would Mallinckrodt would Mallinckrodt and Covidien monitor the length of therapy for individuals on opioids?
I'm not
Objection to
sure.
form.
You weren't ever involved in that?
I can't recall.
You don't recall ever receiving any reports about how patients in this given territory typically are on opioids for 90 days or 120 days?
No. No, I don't recall. I don't know if we got a report like that or not.
We talked a little bit about this with the IC plan, but you received incentive-based compensation, right?
Yes.
Do you recall any were your incentive-based compensations quarterly or annually?
Quarterly.
Do you ever recall a quarter where you did not receive a bonus?
Probably. I can't recall.
Is
Could
it
have happened.
Is it fair to say that you got a bonus more often than you did not get a bonus?
Yes.
And we talked earlier that one component of the incentive-based compensation plan is the amount of prescriptions written for Mallinckrodt products within your territory, right?
That would be most likely a component of it.
As you sit here today, can you recall any other component to the quarterly incentive-based compensation plan?
Not off the top of my head. No, I can't recall.
Do you believe that the number of prescriptions for Mallinckrodt products written in your sales territory was the primary factor in determining your bonus?
Objection to form.
I would imagine it was probably one of the main factors. I mean, any company needs to be able to measure, have some kind of measurement parameters.
Sure. And do you ever recall part of the incentive-based compensation plan being reports of drug abuse or diversion within your territory?
Objection to form.
Can you repeat that question?
Do you ever recall a quarter where the incentive compensation plan incentivized you to identify and report drug abuse and diversion going on within your territory?
I can't
Objection
recall
to
that.
form.
Did it ever happen?
Same objection.
Not that I'm aware of.
Do you recall the incentive-based program called Ironman?
No.
Did some of the incentive-based programs, did they have names? Like this quarter, it's going to be the Ironman program?
Not that I recall. I'm not saying that they didn't, but no. Generally speaking, no. We didn't have names for the incentive plans.
Do you remember an incentive-based program called Run the Warehouse program?
I remember that, yes.
What was that?
I don't remember exactly what it is, but I remember the name.
Do you remember the Fast Start Sales Challenge?
Now that you say Fast Start, I do recall some kind of a Fast Start program.
And do you remember what it entailed?
No.
Was it related to the Zardemis rollout in April of
I
2014?
can't recall.
Do you ever recall Mallinckrodt maintaining a no-call list? In other words, physicians that sales representatives from a structural standpoint were forbidden to call upon?
I don't remember anything specific about it. There could have been.
Would you only call on the physicians on your target list?
I can't recall.
Is it safe to say that the primary people that you called on appeared on the target list?
Yes.
Do you ever recall a single instance where you were ever told to stop calling on a prescriber in Tennessee?
Objection to form.
Not that I'm aware of.
How often would you interact with Mallinckrodt's compliance department?
Define, interact with.
How often would you, well, I assume the compliance department was not in Asheville, right?
Correct.
There's no Asheville office, I assume.
No. My home
Your
was
home
the
is the
office.
Asheville office, right?
Yes. Yes.
And so you don't have a home office that you report to other than your home, right?
Correct.
So I assume that you would have to interact with the compliance department either on the phone or possibly going to a training session out of town. So my question is how often would those interactions take place?
I'm not sure.
Did they ever take place?
They may
Objection to
have.
form.
But as you sit here today, you can't recall a single phone call with the compliance department?
Same objection.
I may have had a call with them. I'm sure I've had some kind of communication with them, but I can't recall specifically if I did or what was said.
Did you have quarterly calls with the compliance department?
I don't know. I don't think we had like a scheduled quarterly call. But to say maybe I spoke with somebody in compliance once a quarter could be accurate. but I'm not sure.
What would you talk to them about?
I'm not sure. I don't know.
Did you learn or ever hear of the term the Oxy Express?
Objection to form.
No, I can't recall.
Do you know anything about the Blue Highway?
No.
Have you? I assume that you are covering East Tennessee. At some point, you were on Interstate 75, right?
Maybe. I don't know.
You don't recall that interstate ever being referred to as the Oxy Express within Mallinckrodt?
No.
Did you hear of anything that happened with Mallinckrodt products being sold in Florida and diverted to Upper East Tennessee?
Nope.
Did you ever interact with the sales folks on the generic side?
No.
Did they ever attend your training seminars?
I don't believe so.
Do you know anybody that worked on the generic side of the business?
No. Not that I'm aware of, anyways.
Hand you a document that we'll mark as Exhibit 18. I'll represent to you that this was a file that was produced natively to us in Excel. It carried the Bates number MNKTNSTA010433353 with a file name of 3 Star Doctors. It's an Excel spreadsheet. Do you see that on the cover page of Exhibit 18?
Yes.
Do you recall a document entitled the 3 Star Doctors document?
This looks familiar. Yep.
Tell me what you recall about this document.
Just that I want to say this is what we use kind of as our, to figure out what doctors we should be seeing, detailing.
And this would be an example of a target list then?
Objection to form.
I guess that would be a name for it.
Well, was the target list something different than what's in this 3 Star Doctor Excel spreadsheet?
It could have been, I'm not sure.
But this would be the information that would generally appear on a target list?
It would be, I don't know if I would say a target list, but it would be a list within our territory of the physicians and how many prescriptions they would write, etc.
So let's go through the columns. There's the first and last name, and I assume that that's the writer, right?
Yep.
Most likely a physician, but could also be a physician's assistant or nurse practitioner, right?
Yes.
Then there's a territory that's listed. Do you see that?
Yes.
And there's 4 or 5 Tennessee territories on here, but there's the Knoxville East Territory. You see that?
Yes.
There's the Asheville Territory, right?
Yes.
And I assume that when you had the Tennessee territory that you covered, that would have been the Asheville. You would have been the Asheville territory, right?
I believe so.
And then there's Chattanooga, Memphis, Nashville East, and Clarksville, right?
Yes.
And then it has the territory rank. What does that mean?
Excuse me. I'm not sure right now. I can't recall.
And then there would be an address, and I assume that that's the address of the clinic that you would be calling on?
I'm assuming that's where they would be practicing, yes.
And then there's the city and the state and the zip code, right?
Yes.
Then there's this call, and I assume that that's a city, state, and zip code of the clinic, right?
Yes.
And then there's a column, Exalgo FY12 PDEs. What does that mean?
Fiscal year 12, I would imagine. I'm not sure what PDE stands for.
And then there's some numbers.
Yeah, I can't recall.
And then there's an Exalgo segment with entries like trialist, dabbler, non-writer.
Mm-hmm.
What does that mean?
I would imagine that would mean if they had written Exalgo, if they hadn't written Exalgo, maybe they wrote it once over the course of 6 months or 12 months, or they write it every day.
And then there's a column Exalgo decile. What is that?
I can't recall.
What does tier mean? A and B.
That I can't recall.
Priority, E, P, or E. Do you remember what that means?
Yeah, probably Exalgo and Pensed, or just Exalgo or just Pensed.
Got it. And then high strength opioid writer. Do you see that?
Yes.
And then there's 3 stars
Okay.
for all of them. Do you see that?
Yes.
And
That's
that
the
would
name of the document.
Me. Picked up to where I'm going. It's almost like you want to be done. Would that be a high strength opioid provider, or do you recall?
I mean, it says high strength opioid writer on there, and there's 3 stars next to it, so I'm not sure if that means that they are or not, but that's what this document says.
Well, I interpreted this document that 3 stars were the high strength opioid writers, and there might be another document with 2 stars and 1 star.
That, if there is, I can't recall.
Okay. Hand you another document. This is a document, again, that was produced to us carrying a Bates number of MNK_TNSTA 01047402, carrying the file name 32MG targets. It's an Excel spreadsheet. Do you see that?
Yes.
Can does the term 32MG targets mean anything to you?
Well, 32 milligrams would be I think the highest dose for Exalgo.
And then you can see that there are, again, it's an Excel spreadsheet containing the lists of what I presume are writers, right?
Yes.
And then there's a line for IMS ID. Do you see that? Sorry, there's a row for IMS ID.
Yes.
I guess that's a column. I'm getting my rows and columns confused. Column for IMS ID.
Yes, I see it.
Then there's the territory, and I assume that that's the internal Mallinckrodt territory, right?
Yes.
Then there's the district and the region, right?
Yes.
And then a state, and they're all from the state of Tennessee. Do you see that?
Yes.
So, do you know what the IMS ID is?
No.
If that was the ID of this particular writer in an IMS health database to help you link up script writing data to physicians on this list, would that surprise you?
Objection to form.
No.
Do you know why these people here would have been listed as a 32 milligram target?
I can't recall why they would be listed as a 32 milligram target.
Do you recall having parameters for people that you were specifically tasked with promoting 32 milligram tablets to?
No.
This is, again, another spreadsheet that was produced to us carrying a Bates number of MNK_TN STA016778661. And it carries the file name of Zardemis Top 25 Target List 30100 Nashville, Tennessee 112613. This document look familiar to you?
Doesn't look familiar.
Would this be another example of a target list for in which to promote Zardemis to?
Could be, yes.
If it carried this name of Zardemis Top 25 Target Lists, would you assume that these are the top 25 targets for Zardemis?
I would assume, yeah, that would be the, yes.
And again, we're kind of seeing the same information here about a physician ID, a physician name, an address, a city, a state, a zip code, right?
Yes.
Then there's a list of specialty, and that's anesthesiologists and orthopedic surgeons, so that's assume the specialty of the physician or the writer that's listed there, right?
Mm-hmm. Yes.
And then there's a specialty group, and then there's pain and orthopedic, and that again is the practice area for the writer, right?
Correct.
And then there's a column for Zardemis decile. Do you know what that means?
What a decile is?
Well, there are, then each physician is given a code of 8, 10, 9.
Yeah, but I can't recall what the specific number stands for.
And then it says there's a raw market volume. Do you see that?
Barely.
And then a Zardemis market volume column.
Okay.
And they're different for each one of the physicians. Do you know if that's the number of scripts that they're writing?
I don't know. I can't recall.
And then there's an Exalgo decile, right?
Yes.
And then there's the group practice flag. Do you see that?
Yes.
And then it says yes or no.
Yes.
Do you know what that means?
I have no idea.
Would this possibly be an example of also a no-call list?
Objection form.
It could be, but I'm not sure.
And then there is an adoption metric column. Do you see that?
Yes.
And so is this an attempt to provide a metric for how quickly these physicians are switching over to Zardemis?
Objection
That
form.
I would have no idea.
Do you recall the difference between Zardemis and Exalgo?
No, not really.
Do you, does looking at some of these documents for target lists that include the territory name or the district refresh any recollection about how far your territory went into Tennessee?
Not really. I mean, I knew I had Johnson City. I can't remember if I had Kingsport. I don't know. I mean, I'd be given a map, and that's, you know, so. But no.
When you worked at Mallinckrodt, did they provide you a computer?
Yes.
Did they provide you a phone?
Yes.
Did you give that back to them when you were let go?
I can't recall.
You were let go from Mallinckrodt during the sort of large layoff where they more or less terminated their specialty sales group, right?
Yes.
And that was nationwide.
Yes.
Did that catch you by surprise?
Yes.
Did you get some sort of severance package when you left?
Small one?
Was there bad feelings on your part when you left Mallinckrodt, or do you feel like you were mistreated?
Objection form.
Mistreated in, like, what do you mean?
Well, fortunately, I've never been subject to a layoff, so I don't really know what it feels like. But I imagine, just being a human being, that it's a pretty gut-wrenching meeting when somebody comes in and says, we're eliminating your job, right?
Objection form.
Was it? Is that what you're asking?
Yeah.
I was already ready to go on to something else, so.
And the something else you went on to was leaving the pharmaceutical world, right?
Yes.
And you started your own business where you opened up these beef jerky outlets, right?
Yes.
Was that in the pipeline when you were let go, or is that something that was Was the layoff something that kind of put you over the edge and said, let's go do
It
this?
was in the works before that.
Okay. How much before?
Probably 12 months before, somewhere around that time. But it was meant to be really more as a income-producing side business.
Okay.
This was the intention of it initially.
Do you have a business partner?
My wife,
Is your wife employed
yes,
with the Vista Retail Group?
yes.
Does she carry a title?
President or vice president, depends on the year. We just kind of switch back and forth.
You're a bolder man than I am, getting in business with my wife. My hat's off to you. I think I'm largely done. Let me review my notes. Give me 10 or 15 minutes.
Okay.
It is 3 p.m., we're off the record. It is 3:25, we're back on the record.
Elizabeth, I think you might not be on mute.
Okay, thank you.
Do you know who Heather Duncan is?
I believe she was a physician.
Do you know who Cheryl Herbold is?
Who?
Cheryl Herbold.
No.
When you onboarded at Covidian, you said that you had met with the district manager. Was that Todd Dean?
Yes.
And you had a discussion with him about the position?
Yes.
And did he tell you that they were experiencing rapid turnover in the position at that time?
No.
Did he describe to you how the turnover was related to pill mill operations in Tennessee?
Objection to form.
No.
Did he describe to you at all that they had problems filling the position?
No.
Did he describe to you that Exalgo at the time was not on the approved medication list for Blue Cross Blue Shield Tennessee?
No.
Did he describe to you that Exalgo was not on the approved list for TennCare?
No.
I assume that at some point you found those two factors out.
Objection to form.
I would imagine at some point in the training or when I first got into my territory, started working it, but not part of the interviewing process.
Did you have a discussion with him about how the Tennessee target lists were being generated?
Not that I recall.
Did he tell you that there were known pill mill operations on the Tennessee target list?
Objection to form.
No.
Did he tell you that they were trying to scrub the target list to avoid calling on Tennessee pill mills?
Same objection.
No.
Would it surprise you to learn that some of the physicians that you called upon have been federally indicted for writing improper opioid scripts?
Objection to form.
I am aware of that now, yes.
And what are the physicians that you're aware of that have been federally indicted?
Same objection.
Only one that I know of.
And who is that?
I guess Dr. Muhammad.
How often would you call upon Dr. Muhammad?
Same
I
objection.
can't recall.
Do you know if he is in federal prison as we sit here today?
That I'm not sure of.
Does it cause you any concern about the work that you were doing that you were calling upon Dr. Muhammad during your work at Mallinckrodt?
Same
Not at
objection.
all.
Did he, was he a known Exalgo scriptwriter?
That I'm not sure of. I can't recall.
Do you recall ever seeing anything suspicious when you called upon Dr. Muhammad's office?
No.
Do you recall anything specific about his particular operation?
No.
When do you think?
But that's not my, my job's to go in and talk to him about the benefits of the medicine, and that's it.
And you didn't see your job as being monitoring those physicians for potential illegal pill mill activity?
Objection to form.
That wouldn't be in my, I'm not going in and investigating physicians or anything like that.
You weren't trained on that by Mallinckrodt to identify pill mill
Objection
operations,
form.
right?
Not that I'm aware of.
I'm going to hand you a copy of what I promise will be my last exhibit.
Thanks.
And I don't really want to go through these, but I will represent to you that Exhibit 21 is a collection of various expense reports that you submitted during your time at Mallinckrodt. Feel free to take as much time with this document, but really I just want you to confirm that these are the types of expense reports that you would typically submit for your work at Mallinckrodt, calling on physicians in your promotion activity for those specialty pharmaceuticals that you were promoting. And again, it's several pages, and I know that. Take as much time as you want with it, but
This does look, yeah, this looks like an expense report that I would have submitted.
and there are expense reports here for like hotel stays, right? Because sometimes you couldn't quite make it home at night, is that right?
Correct.
And there are meals in here too, right?
Yes.
And those would be just kind of the general expenses that you would incur as a result of being out on the road doing work on behalf of Mallinckrodt, right?
Correct.
And this isn't meant to be at all sort of a comprehensive list of your expense reports. I'm sure that there are far more than what's here in Exhibit 21, but these would be kind of representative samples, correct?
Objective form.
Yes.
I'll pass the witness.
Elizabeth, do you have anything? A few questions.
I do not have any questions.
Thanks. I just have a few additional questions for you today. You testified earlier today about training you received from Mallinckrodt. Do you recall that testimony?
Yes.
Can you describe at a high level the training that you received?
Yep. So after the start date, we would receive a rather large packet of training materials. So as I recall, it would be, say, a week of home study on each product, followed up at the end of each week by like some kind of a test to make sure that we were competent of the material that we were going over. And then at the end of that, or shortly thereafter, then we would go to the home office in St. Louis or wherever that would be and get further training there. It would either be, as I recall, a 2 or 3 week stay at the headquarters, and there we would go over more training, practice, going over the detail aids that we were given, more information about the disease state, etc.
Now, you mentioned the detailed aids. Are those sales aids?
Sales aids, yes.
And what were sales aids?
Sales aids were the material that we used when we were talking with physicians. So this is what we went in, showed them the sales aid, and that's what we would speak to, is the sales aid.
And how did you get those sales aids?
They came directly from Mallinckrodt.
Were you trained by Mallinckrodt on how to use those sales aids?
Yes.
And can you describe generally what that training entailed?
It would either be home office training or, basically a step-by-step. Here's the first page. Let's go over the 10 points of this first page, then the second page, and the third page. And it would be, benefits of the product, possible side effects of the products, the PI at the end. We would go through every detail of the package insert, any kind of side effects, any black box warnings, anything like that.
When you did actually called on doctors, did you use those sales aids during those calls?
Yes.
Did you ever use any materials other than the sales aids that Mallinckrodt had provided to you?
No, and the reason why would be that my understanding is everything that was handed to us had been approved through attorneys, had been FDA approved, so therefore we were given the green light to discuss those materials. And in my 14, 15 years of doing it, you learned you didn't speak off topic or off label about stuff. You just didn't do that.
During your calls on prescribers, do you recall discussing side effects or potential risks associated with opioids?
Yes.
What was your primary goal when calling on doctors?
Primary goal would be to educate the prescriber about disease state, say pain management, whatever it would be, about the product, possible insurance, for their practice, what insurance would cover certain products, and disease state. So basically it was a general education or a specific education to help the doctors better treat their patients.
Did you ever market any generic opioid medication to a prescriber?
No.
When you were calling on doctors while at Mallinckrodt, did you market, was there ever a doctor that you would market an opioid and a non-opioid medication to?
Yes.
Do you remember what any of the non-opioid medications that you might market were?
Penzed, as an example.
And do you recall what Penzed was?
It was a topical pain reliever.
And were there times that you marketed to the same doctor Penzed and Exalgo?
Yes.
You testified earlier today that there were times during the course of your career as a sales rep when you visited doctors' offices that there was a line of patients out the door. Do you recall that testimony?
Yes.
Was that something that was a concern to you when you saw patients lined up out the door?
Not necessarily.
Why not?
Because there could be any number of reasons why there would be large groups of people in the office or in the waiting room. Doctors could be busy working out, or getting to the office late, so they get backed up, which is very regular. Or let's just say they were at a lunch with, say, a pharmaceutical rep, getting educated about something. Then if it spilled over to, back when they were starting to see patients again, that could back up the practice very easily.
Do you recall whether there was times during your career as a sales rep, whether at Mallinckrodt or GSK, that you saw patients line up out the door at a practice that you were not marketing opioids to?
Yes. All the time, especially, yes. OBGYNs, for example. Yes, definitely.
Did anyone at Mallinckrodt ever pressure you to do anything that you consider to be unethical?
No.
Did anyone at Mallinckrodt ever ask you to do anything you consider to be unethical?
No.
If you were concerned that a doctor on your target list was acting improperly, prescribing medication improperly, would you continue to call on that doctor?
No.
Why not?
For ethical reasons. I just wouldn't feel, I would not feel comfortable doing that. It would, from an ethical standpoint, it would bother me.
I have nothing further.
Just real quickly, did you ever stop calling on Dr. Muhammad's office?
Not that I'm aware of.
Do you ever recall stop calling on any doctor's office when you were working for Mallinckrodt Covidien because you saw something suspicious?
Objection informed.
Not that I'm aware of. Not that I can recall.
No other questions.
One last follow-up question. Do you ever recall a time during your time at Mallinckrodt that you were marketing an opioid product, that you were concerned that a doctor was acting in a suspicious manner?
No.
Nothing further. Still nothing, Elizabeth?
You're on mute if you said
Sorry.
anything.
Sorry, I was on mute. No, I do not have any questions.
She don't have any questions? No, no questions. Elizabeth, do you know what your order is for the transcript for the video?
Should we go off the record?
I do not want a copy of the video. Are you speaking to me?
Yeah, do you want a copy of the transcript?
I think you can shut it down.
Yeah, we
Not
we
at
go
this
off the
time.
record.
Okay. Thank you.
Thank you.
This concludes the deposition of Eric Henchman, media number 4. The time is 3:40 p.m. We are off the record.